Africa's top public health official says severe lockdowns are no longer the best way to contain COVID-19. Africa's CDC Director John Nkengasong said this as he praised South Africa for adopting that approach when responding to its latest infection wave driven by the Omicron variant. South Africa recorded a steep rise in COVID-19 infections when it alerted the world of the Omicron variant in November. The country experienced a peak in infections in mid-December. Since then, the country has recorded a drop in new cases and announced the easing of restrictions before New Year's Eve. Nkengasong says he fears that COVID-19 could become endemic on the continent given the slow pace of vaccination. Let's bring in Dr. Bharat Pankania, Senior Clinical Lecturer at University of Exeter Medical School. He joins us from Bath in the United Kingdom. Thank you very much, Dr. Pankania, for joining us. Africa's CDC is against lockdowns as a way to contain COVID-19. What would you suggest as the best way to deal with the pandemic moving forward?
Yes, it's very difficult for Africa to have a European model, and the European model of restrictions and stay at home will not work for Africa. People in Africa need to go to work to have the money to buy the food to feed themselves. So what will work, and this is something we have said repeatedly, is immunize your people. And we really need to immunize Africa at great speed. The other things that we can do, and we must do as well, is not forget that infection control is multifaceted. Therefore, wear good quality masks, have ventilation, have good hand hygiene, and do all those measures together with get immunized, and that will be a good way forward for Africa and the rest of the world, to be honest.
Now, the numbers in Europe and the United States continue to increase. However, hospitalization in Africa is still significantly low. What would you attribute this to?
So in Africa, we have a different population structure. The African continent is predominantly a younger population, and we know that SARS-CoV-2 affects older people much more. So the European population is a lot older, and therefore we have much more hospitalizations compared to the younger population, and therefore most people in Africa are not hospitalized.
All right, Dr. Bharat Pankania, thank you very much for joining us.
Thank you.